Welcome everybody to the Kidney Coach YouTube channel. Today I am joined by the amazing Cody Kennedy. Cody is the Director and Principal Naturopath at the award-winning clinic CK Health, which is located in Newcastle, New South Wales. Cody is an amazing human that I've known for quite a long time, and she's amazing in the fact that she really believes that the human body is smart enough to heal itself if we can just give it a nudge in the right direction. She has a special interest in treating complex health conditions, but her absolute passion and what she's really serious about in her niche is lupus. And as we know, our kidney coach community, lots of people with kidney disease, sometimes have gotten to that place because of having lupus. So we thought we'd have Cody on today to talk all things lupus and kidney. Cody, you can reach her. She's got, I'll put all the links to her clinic and everything in there. But the thing I do want to point out, which I think is really useful for people, is that she's got a Facebook group called the Natural Lupus Solution, which is aimed at positive natural support for people diagnosed with lupus. It's got over 2,000 members in there, so I'll make sure I put the link in there. And I should mention that Cody holds an honour degree in complementary medicine with a keen eye and a keen interest in research. She's also been awarded a graduate diploma in evidence-based medicine, which means that everything Cody recommends and everything that she's going to talk about today has been researched, tested, and researched again. I know she's a huge believer, sure that complementary medicine has that real grounding and an evidence base, and I think that's really an amazing thing that Cody brings to what she does. So Cody, thank you for joining us today, and thank you for coming and speaking to our kidney coach community. I was really excited that you agreed to chat to us and dive in and talk about all things lupus. Is there anything you wanted to add to my intro to you? Anything I missed before we dive on?
No, I think you've pretty much covered it. I think that's good.
Excellent. All right. So I guess I want to start by maybe getting everybody understanding why you've got such an interest in lupus, because it's a bit of a personal story. So why don't we start there?
Yes. So my husband has lupus and his mother had lupus as well. So there's a bit of a family theme happening with that. His mother was diagnosed when I think she was in her 30s, and she had a very mild case of it, but my husband was not diagnosed till much later, and his was quite a severe case when he was diagnosed. So I think most people are aware that lupus is a lot more common in women, so he was just an unlucky male. So we've been through a bit of a journey with that. Certainly, been through the rigmarole of having some serious flares and getting things under control, and it really just made me a lot more passionate about it. And there was one point, I think he was on about 6 or 7 meds, and we were like, okay, there's got to be some things that we could be doing that are going to at least cull some of these medications out. And that's really when I started to definitely be more interested in it and do more research into it and see what we could do naturally to help people manage this disease.
Yeah, wow. I remember I was catching up, and it must have been 6-7 years ago at least now, and you telling me about this. And so how is his health? How has he gone with all the amazing support he's had from you?
So he is doing amazingly well now. So there was a situation it would have been about 6 years ago when he got vasculitis, which it can be part of that lupus picture as well, and lots of inflammation in the blood vessels. And this led him to be on multiple medications, and the doctors were they didn't want to rock the boat by taking him off of things. And, we were just like, well, let's maybe start with the fact that he's on a reflux med. Let's see if we can pull that one out. So we kind of started, to see what we could change and what was safe to change, obviously with his doctor's, recommendation and okaying what we were doing. Now he's on one med, which is thyroxine, which he will always be on because he has an underactive thyroid. So he doesn't take anything else. He's going really well. The lupus seems to have completely calmed down. There's other autoimmune things going on for him, unfortunately, but in terms of the SLE, he's actually really, really good.
That's amazing, and what a testament, and how lucky he is to have you to be able to support him through that journey. Was he always complementary medicine, or was he someone that you had to drag kicking and screaming into trying your stuff?
Luckily for me, he wasn't kicking and screaming. He was really quite, no, I'll do it, let's give it a good go. And you know, he's been a bit of a guinea pig, I suppose, over that time as well. We've certainly tried some things on him and gone, wow, that worked, and no, we won't do that, that didn't work. So that's been an interesting side of it, but he's very happy to play along, and yeah, I think it has surprised him sometimes, the improvements that we've had when we've done things.
Well, I think we need to thank him for letting you testing on him, and just definitely know what works, and so your amazing patients get to reap the rewards. So why don't we start off by, why don't you give me an overview of how you understand what SLE is, lupus, and how that, because it's so far reaching in the body, just how that can look and how it may manifest.
Yes, so I guess it's a particularly complex autoimmune disease because it is so systemic, and it can go everywhere in the body. You know, it can be something as minor as a bit of joint pain, or, you know, the butterfly rash across the nose, or it can be something as full on as organ failure, you know, affects the brain, causes seizures. It's really so multifaceted that's what makes it so hard to diagnose initially, I think. And two, makes it so hard for people to cope with. I mean, you know, some of the symptoms can be something as simple as mouth ulcers, and other times it can be things as full on as seizures. So it definitely is multifaceted, predominantly affecting women and predominantly in their reproductive years. So women between the ages of about 15 and say in their 40s, that's the main group that are getting diagnosed. So I think it's 9 out of 10 people who have lupus will be female. So there's, like I say, there's very few people who have it who are male. It can come on in a whole multitude of ways, and there isn't one, you know, hard and fast way that it comes on. It definitely seems to affect more people who are non-Caucasian. So Afro-Caribbeans, Asians, tend to, one, have the disease with greater severity, and they're more likely to develop it. So I think in the States, I think it's 1 in every 250 Afro-Caribbeans will have lupus, will develop lupus, which is phenomenal compared to a sort of Caucasian subset of people with lupus.
That's amazing. What do you think? You know, there's so many theories about what drives autoimmunity. I'd be interested to hear what you think potentially drives lupus, and what, you know, we often talk about in the Kidney Disease Solution, and our kidney coach crew will know, we always talk about drivers of disease. What do you believe are the contributing drivers to this in people?
I think that there's quite a few. I don't think, you know, again, unfortunately, I think if there was just one driver, it would make everybody's life a lot easier. But I think there's lots of drivers. Definitely that hereditary aspect. As I said with my husband, his mother had it. And that doesn't always have to be the case, but there does seem to be a bit of a theme. If you have a parent who has it, I think you have more chances of developing it. But there also has to be that environmental aspect to it as well. So you might have the genes, but you might have the perfect storm happen in your environment that brings that on, and then you might not, and you might never develop it. I mean, the other interesting thing with my husband is he's got 2 sisters, and neither of them have lupus. And yet they are in the sex that means they are more likely to develop it, but for them it never happens. So getting back to your question, what could be the cause? I think can be inherited. It's about, I definitely think there's some links in with different infections and viruses that can bring it on as well. It can be medication induced. I know that there's some meds that can bring it on as well. It can be also things like, I think sometimes some tick bites and things like that can tend to bring these sorts of things on. And the other thing is you're all going back to the gut, and how your immune system's functioning can have an impact as well. diet, lifestyle, leading a lifestyle where you're drinking and smoking and living, burning the candle at both ends, and all of those sorts of things, I think, will have an impact on your immune system. And then this is when these types of things can rear their ugly heads, I think.
Yeah, it's so interesting. Do you know what the driver was for your husband? I mean, obviously, in that because it's so unusual in men.
Well, that's hard. That's yes, part genetic, definitely. But interestingly, with him, when he was 7, he lived in Fiji for about 3 or 4 years, and he actually had some unknown virus over there, and he was quite ill and in a hospital, and they never really diagnosed what it was. And he sort of says that after that, he always felt very irritated and as if there was something wrong with him. And then when he was about 16, he started to get joint pain, and he was diagnosed with mixed connective tissue disease. The lupus came much later, but there definitely did seem to be some infectious element to it as well, I think.
It's interesting, we call that the never been well since. And so now
that's right, exactly that.
We go digging for that. It's one of my favorite questions. It's like, do you remember a time you've never been well since? And that is definitely sounds like that.
Yeah.
So talking about that, walk me through lupus, because you're talking about the immune system and the gut. How, and we obviously know the genetics, but how does it manifest in the body? What are the physical symptoms and the systems and the organs, and how does this disease manifest? And I know obviously it can manifest in so many different ways, but give me the view of what's happening inside the body when someone's diagnosed with lupus.
Well, I guess really in one word, it's inflammation. It's the immune system going berserk and attacking parts of the body that it shouldn't really be attacking, and just having this overdriven inflammatory response. And people with lupus tend to, if you and I had something that was really small and, like say we hurt our finger, but people with lupus, their immune system tends to go there and do all the processes that should normally happen to calm down that inflammation, but then it just keeps going and it doesn't really seem to stop. So it really is just this overactive immune response, and then this inflammatory response that just goes way above and beyond what it should. I mean, lots of women notice that they get flares of lupus. So lupus is definitely that pattern of, relaxing and then flaring, and then calming down and then flaring, calming down and flaring. And a lot of women will notice that around the time when they get their period is when they go into flares. So there definitely is a hormonal component to it as well. But fevers would be one symptom that is often a very early symptom, and people will just say, I just noticed that, I seem to get a fever and I feel like I'm coming down with something, and then nothing happens. That really, when anyone says that, if they've not been diagnosed, it really makes me kind of sit up and go, that's a bit of a lupus thing. Okay, so they might have some anomalies in their blood as well. They might have slightly low neutrophils, or their platelets might be slightly lower and larger in size. And so there'll be some things that are happening, rumbling along, and that can go on for a few years before they're actually diagnosed with SLE.
I find it such a fascinating disease. Obviously, I've got an interest in multiple sclerosis because of my own history.
Yes.
The immune system has gone crazy just for the myelin sheath. But what I find so fascinating in lupus is, and we talk about this Th1, Th2 dominance, and I won't get technical for people, but most of our autoimmune diseases is this overreaction of Th1 where it's a specific organ. But lupus, it's like, I might go for the blood vessels, or today is kidneys, or today is brain.
That's right.
So fascinating how it isn't discriminatory to one organ. It is just so everywhere, which makes it like hard to diagnose, hard to treat, and potentially for some people, I mean, lupus will kill people. MS will not. And, MS may disable people, but lupus can, of course, as you mentioned, with organ failure and things like that. So I find it a super fascinating disease. Do you have thoughts on why someone's immune, and maybe I'm asking, I mean, this is the age-old question, so this may be a really ask, but what is it in one person that may make it this really defined thing, and then you've got in other people where the immune system, it's like you say, it's just everywhere, this totally out of control immune response.
Yeah.
Yeah,
well, I mean, that is the big question, I suppose, isn't it? And I really don't know. I mean, it's like, why does it, for some people, you know, they'll get a lot of pericarditis, or they might get a lot of brain involvement, and, you know, lots of headaches and lots of inflammation in the brain and brain fog and memory issues and things like that. It's like, I don't really know. Maybe it's a weakness in the body already and that's why it goes there. I'm really not sure. But it's a great question. I wish I had the answer, but I don't think they really know. I mean, to some degree, we know why it does kind of go towards the kidneys, or we know, I shouldn't say we know why, we know what happens when it goes to the kidneys. But I think that in terms of why it goes to specific areas, who knows, really.
Tell me more about why it goes to the kidneys, since that's something that,
So we know that when someone has lupus, they can get an anti-DNA antibody. And when you have that, it goes to the nephrons, and that's where you're getting a direct assault of immune complexes on the nephrons in the kidneys. And when that happens, so you've got so someone who has anti-DNA antibodies, I don't want to get too technical, but if you have those, you're more likely to have issues with your kidneys, because for some reason this immune complex does go to the nephrons and does sort of affect how the nephrons are working and the amount of inflammation in there. And then your complements will start to lower. So when you get that kind of picture happening, then you've got more issues with kidney function and inflammation in that area of the body.
Fascinating. So and I'll get you to walk us through the blood tests that people may have out when they're diagnosed, but so you know when someone comes in front of you and they bring in your test and say they've got elevated ANA, but they've got this anti-DNA complex, and you know their comp pathways are changed, you know, okay, I know I'm going to have to go and do some work on their kidneys to protect them, because that picture looks more of a kidney picture, which I know obviously kidney failure, and that, you know, that's something we work ahead. Versus, yes, we may have some vasculitis and other things, but I know potentially that the kidneys are going to be involved. And that's something I didn't know about lupus. So that's super fascinating. I think anyone out there, if you've been diagnosed with lupus and maybe your GP or your immunologist hasn't told you that, that's definitely something to look out for. But walk us through what blood tests generally people are presenting with, because it's such a hard diagnosis. And in MS, raise ANA all the time, which is one of the markers, but you know, kind of big picture. So walk us through what people are likely to see on blood tests that would make someone diagnose lupus.
So I guess initially most doctors will start with that ANA panel, and they'll start with that. They might look at things like antiphospholipid antibodies as well. They'll do anti-DNA, complement C3 and C4, which are your immune markers, which generally will drop with disease activity as well. They'll do your CRP and ESR, which were two other inflammatory markers. Iron would be another one, so a full iron study to see if you're, you know, how that also helps to work out how inflamed you are. I mean, even doing a regular full blood count, if, like I say, if you see in there that someone's got low hemoglobin and their neutrophils are on the lower side, or their platelets are looking slightly different shapes or sizes, or then that in itself can be a bit of a, you know, a warning sign that something is going on. But unfortunately for people with lupus, there is not one definitive test that says, yes, you have lupus. And this is why it takes so long for people to be diagnosed, because they generally will have symptoms for quite some time and they'll be running all these tests, and often the tests will be negative as well. And I personally think they probably just haven't found the thing they need to test for, or they can't do a test for whatever it is that they need to check. And then it will be put together, your diagnosis is generally put together by your symptomatic picture and your blood results. So they'll say, well, you've got 5 of those symptoms and you're positive on 2 of the bloods, therefore we're going to diagnose you with lupus SLE.
Wow, so it really is a excluding other diagnoses and nothing else fits kind of disease, huh?
Yeah.
And I guess it's the systemic effect of it as well, right? So it's, you know, when we've got these other mixed connective tissue disorders, like you said, your husband was originally diagnosed with rheumatoid arthritis, which could all be part of a
That's
SLE.
right.
It's, you need to have that and more for people to be thinking about lupus, I guess.
Yeah.
And I mean, I'm digressing here, but you know, I often wonder with these diseases, the fact that your husband was diagnosed with mixed connective first. And I'm like, I often wonder if these diseases are all related, and it's a bit like a horse bolting from the stables. You know, it starts maybe one way, and lupus potentially is an end result of this bolting horse bolting into all of these organs and systems versus more specific autoimmune diseases that tends to just affect one system. We know, for instance, in multiple sclerosis, a huge percentage of our MS patients go on to get hypothyroidism. And it's that complex picture. And I would say 75% of my MS patients have positive ANAs, which I find fascinating, which tells me there is, for me, an ANA, an anti-nuclear antibodies, and they're very low levels, but I'm like, there is a that's, you know, not quite doing what it should do. And it's not just in the myelin sheath, it's everywhere. So I know my ANA guys are far more likely to develop thyroid disease. So I'm always checking antibodies, like you were saying with that. So I just find that the whole autoimmune thing it's so fascinating, isn't it? How it... Sorry, I digressed there.
I know, but what I was going to add to that, Fiona, was one of the, I mean, we also see a bit of Hashimoto's, you know, mixed in with lupus, and I guess that makes complete sense. If the body's being attacked all over, then why not the thyroid gland, the gland that is so incredibly sensitive to any change in the body, really. But another condition that is often seen with lupus will be Sjogren's. So, you know, where people get this dryness of the mouth and, you know, dry mucous membranes, and this is, you know, it's not that unusual for those two conditions to be found together. So yeah, it's really, really, I just, like I say, I find the whole thing fascinating. It's a thing I ponder on often with the bigger picture behind it. Why? Yeah.
So we've talked about blood tests and what it is and how it manifests. And I know for some people think, oh, it's not like we can go, it's like, you know, if we've got a cancer diagnosis, we know there's cancer cells and we know it's located here. Or if we've got, I don't know, asthma, and we know it's, you know, excess mucus in the... Such an SLE is such a hard one to give people this definitive thing, except to say that there's this elevated inflammatory markers, and then however they deposit themselves in the body and how that affects the organ. So then with that in mind, how does Western medicine treat lupus, and is it effective? And, you know, are there, as there are with all drugs, what are the sort of side effects in that treatment plan? Walk me through if I was to see a Western doctor, what that from diagnosis, what my life potentially looks like.
Yeah. So I guess the first thing that they would probably do is put you on Plaquenil. So Plaquenil, a lot of people might know this as hydroxychloroquine because it's been used a little bit with COVID. So that would probably be the most common first port of call for people with lupus, that and prednisone. So your steroids.
So prednisone makes sense, anti-inflammatory. So walk me through Plaquenil, because I know this is an anti-malarial. Yes. So I find it fascinating because we're now suddenly saying that this autoimmune disease, we're using it with anti-malarial drugs. So walk me through that, because obviously Western medicine says there's no infective component. We know with your husband, it looks like the immune system responds that way with fevers and things. So walk me through that.
So the main consensus with the Plaquenil is that it reduces the disease progression, and it is the drug that they've used for lupus for a long time. I would say, to my knowledge, at least 40 years they've been using Plaquenil. And actually the medications for lupus have not really changed a lot in the last 30, 40 years. It is, as you say, it is a anti-malarial, but they think that Plaquenil slows the progression of the disease and reduces the likelihood of the disease going to the kidneys.
Ah, fascinating.
So that's one of the main reasons. I mean, generally when people are taking Plaquenil, I guess one of the good things about it is it has been used for a long time. The safety profile on it, we're pretty set on. Long term, it can cause issues with vision. That's probably the thing people worry about the most. And because this is potentially a drug you're on for the rest of your life, then that would be the biggest worry. And then, of course, when people come off it, they worry because obviously they're coming off something that's supposed to slow the disease progression. So you get into this, caught up in this cycle of, what am I taking and why? Basically, the other sorts of medications you might go on are things like cyclophosphamide, which is a chemo drug, but the dose of it for lupus is lower than what people would be taking if they were having full-on chemotherapy. That has some risks, I'm pretty sure, to the bladder for that, so it increases your risk of bladder cancer. Mycophenolate would be another one. That's more when people do get into the kidney issues. They might use that as well. And then, of course, they'll do things like you'll be on blood pressure medications, and you might be on reflux medications because some of your other medications are giving you reflux. And it's not uncommon to see people on antidepressants and sleeping pills and all of those other things added in as well. The prednisone, the steroid, tends to come and go a bit. So I've certainly had clients who, can do 6 months off of prednisone, and then they'll go into a flare and they'll be on it, and then it takes them ages to get off of it because they might still need to be on 5 milligrams a day long term, and it's a very, very tricky condition. But the meds have their own side effects as well. So as I said about the Plaquenil, that's mainly the eyes that we're worrying about. With the prednisone, it increases your risk of type 2 diabetes. Anything over 7.5 milligrams a day, which is really not a very high dose, and it's not uncommon for people with lupus to be on more than that, increases your risk of osteoporosis. And osteoporosis is not uncommon in women once they start to get into their 40s who have got lupus. So that's not always great long term. And also some people just don't respond that well to the meds. They get nausea, they get more skin rashes. Some people feel really dizzy on some of these meds and, have other issues because of them.
Yeah, it's a big one. And what about with kidney disease? Is there and kidneys and lupus? Is there any more specific? You mentioned the Plaquenil. Is there anything else that might be thrown in that mix if they were heading down the kidney path or kidney damage?
So probably the myfortic, the mycophenolate, is the most common one that they'll put you on for the kidneys, but they will throw in all of the, they'd probably put you on a statin and a blood pressure med just to try and balance everything out, and a diuretic, they may even do a diuretic as well, and to try and get your blood pressure okay. So it's kind of working with that balance of blood pressure, kidneys, heart disease, and that's when it all really starts to get a lot more complex, I think.
Right, so the ones we'd see in kidney disease are going to get used if lupus is affecting the kidneys. They're going to throw that. Yeah, wow. And it makes it, we know in kidney disease, we talk about the triple whammy of the 3 drugs together that are going to increase the risk of kidney disease. And it sounds to me like that is a mix that would get used in lupus. So potentially some of the drugs in lupus potentially, and we know that triple whammy, and I don't actually have the figures in front of me. I know we've written blogs on it, but I think the increase to kidney disease from non-steroidal anti-inflammatory, and then
that's right.
I think there's an ACE and there's one other in there. If you use those three in combination, you increase kidney disease. So
yeah,
definitely something we'd want to avoid. So I don't know whether this is a straight percentage that you can pull off the top of your head, but with people that are diagnosed with lupus, what are the percentage that will go on to experience some sort of decline in kidney function?
So the stats are about 30 to 50%.
Wow.
So it is really quite high. From my point of view, if we just get in there really early and start protecting the kidneys, hopefully they'll just have some minor kidney involvement, not major kidney involvement.
So that is something that you would, and especially if they've got that anti-DNA on their blood test, but that's something that you go straight in with and work on the kidneys from the beginning of diagnosis?
Yes, so one of the other things I didn't mention when they're doing those initial lab tests is they will always do a urine test as well. And if someone is even showing, and they will do GFR as well. So they'll do estimated GFR, which is not perfect, but at least it will give us some idea. So that's looking at how well your kidneys are filtering everything. If in that urine test, it's got, protein and some white cells, often that just gets ignored. Oh, that's nothing. That's something minor. Don't worry about that. Whereas right from the beginning, if I see that in someone's urine test, I'll be like, we've got to start working. Let's work on this now, continually, so that it doesn't develop into anything more. But already that's showing that it's a red flag that there's something going on already. But often it just gets put aside because there's much bigger things going on as well in the body.
Yeah, it's fascinating. I mean, I see that in the clinic too, where things that I think that's a big deal do get put aside. And I understand because medicine can sometimes get a little tunnel vision, whereas as naturopaths, we're taught very much to be holistic. I wanted to ask you, with people with lupus, and we know that it can potentially be a terminal disease, for want of a better word, generally organ failure and particularly kidney failure that is going to be the thing that will be the big thing that will complicate lupus, in the fact that people may lose their lives from it. Is that correct, or have I got that wrong?
So that's definitely part of it, but I also think they are, because they've been often on immunosuppressants for so long, you have an increased risk of developing cancer because your immune system's obviously constantly being pushed down. And then you've got those blood disorders that can start to complicate things a bit more as well. So, I think there is actually a bit of a plethora really of conditions that come in and just make things more complex as people age with lupus.
That makes sense. And tell me, so 30 to 50% of people go on to develop some kind of kidney decline. What percentage of people need potentially a kidney transplant?
I think it's about 10 or 20%. It isn't a huge amount. Sorry, it's actually 10 to 30% of people will go on to develop kidney failure. So of that percentage of people who develop kidney issues.
Yeah. Okay. And I mean, we obviously know about it. Selena Gomez went through and had a kidney transplant. Yes. And do you find, because the other thing I'm wondering too, kidney transplants, obviously people can sit on that list for a long time. And this is something I don't know, whether having something like lupus makes it harder to get a transplant because potentially you're more likely to get organ rejection because of all the medications, everything else going on, whether that pushes people down the list, I'm not sure, but I guess.
So unfortunately it does. So I I think it was last year now, I had a client who she needed a triple, she needed lungs, heart and kidney. This was the lupus patient. And they basically had said that they couldn't do the surgery, they couldn't do this because she had a systemic disease, and you know, it was just whatever they put in her was just going to be attacked again. And so it does. It doesn't mean that it won't happen. I've got another client at the moment who's on the list and waiting. She's in the UK, and we're just sort of working towards getting her as well as can be, so that when it does happen, so it doesn't mean it won't happen. But I definitely think once you get to that kind of stage where you've got, you know, multiple organ failure anyway, it really is very difficult to be on that transplant list and make it happen.
So I guess the big thing we need to do is get in early, like you say, and we always say prevention is better than cure. So let's move away from this, the sadness and lupus. The good thing is you and I know there is so much that can be done. As your husband had quite serious lupus, it sounded like, and quite multi-system involved, and he's very well. So what we might do is I want to start with a really high level overview of just what can be done, and then Cody and I are going to jump in and do another recording, and we're going to get right into the treatment. But let's just start by giving me the good news. What can we do, and what, maybe share some great success stories that you have seen in clinic where people are doing this big holistic treatment and what's happening?
Yeah. So I definitely think diet is a big thing. So, you know, looking at more of a whole food diet, that's a very simplistic way of saying it, but moving away from processed foods and alcohol and smoking and, you know, all of those kinds of things, they all just have a much bigger negative effect on your health anyway, but particularly when you have something like lupus. I always kind of bring in some herbs as well and use our beautiful herbs and different ones for different things. And I do treat very individually as well. So it just depends how the person presents as to what I will actually do. But that would definitely be like the basis would be to start on the diet. How can we overdose this person on nutrition, get some nutrition into them easily without them having to work, their body having to work very hard, and what supplements can we do to just reduce that inflammation? And like you say, there's some great studies that have been done on using, you know, less saturated fat in the diet, for example, and more omega-3s, and, you know, just making a couple of small changes like that, I think the body functions better. And instead of hindering it, you're helping it more with nutrition and supplementation. I do have two beautiful clients that I've worked with for quite a number of years now that are both in remission. So that was really huge. So one of them, her name is Ursula, and she is actually the Facebook group that I set up. I don't manage that group anymore. I actually passed it over to Ursula. She was very passionate about it, and my workload just got a bit too full on. So Ursula now manages, I'm still involved a little bit, but she predominantly manages that group. And when I first met her, she had lots of heart involvement. So mainly in the form of pericarditis, a little bit of kidney involvement as well. Although she was one of those cases where her kidneys were involved, some inflammation in the kidneys, but it hadn't yet got to the point where it was really out of control. And Ursula was one of these great clients who, whatever I said, she did it. So she really just was like, whatever, and she had this amazing attitude towards it as well, very positive, very much, I'm going to beat this thing. And I would say after we did, so Ursula also, I should add, she had actually had stem cell therapy, but she'd had the stem cell therapy and had some improvement, and that's when she came to me and said, hey, I need to do more than this, what else can we do? So we went in and we did a lot more work, and then basically from that point is when she got into remission, and I think she's been in remission now for about 3 years. Amazing. So every time she gets her bloods done, Everything's still always, I still see her probably about every 3 months or 6 months maybe, and we just check in. She does her bloods and we make sure everything's going okay, and we kind of look at her diet and make sure she's actually now vegan as well, which she wasn't when we first started working together. So we always make sure that she's not, missing any of her nutrients being vegan, and just checking on everything. So she's going really well. And another lady that I worked with, her name is Michelle. And Michelle she did have a bit of kidney involvement as well, but she was another one of those cases where it wasn't out of control. We did lots of work together, and she was slowly sort of improving, and we, changed her diet. We did quite a bit of gut work, and, actually looked at her hormones, her reproductive hormones a little bit as well, and got a certain, let's say she got about 70% better, but there was still something niggling away. And without getting into a whole nother conversation, she actually had breast implants, which she had removed. And when she had them removed, they found that she had silicone in her lymph nodes under her arms. And we went on to this whole detox protocol of getting rid of excess heavy metals in the body. And that is really when she went completely into remission. So this is why I say, you just got to look at all these other things that are playing into that condition as well, and not just assume that, you're just working on the inflammation, and overdosing on nutrition and doing the right supplements is great, but sometimes you have to look outside the box a little bit and see if there is anything else going on that's possibly contributing.
Yeah, fascinating. I've got 3 or 4 patients with MS with implants, and we do a timeline and they match up. So I've got 2 going in for them to be removed in the next couple of months.
Right.
So yeah, that foreign object in the body, the immune system. The immune system's a smart behave itself. So
that's right.
Well, that's so good to hear. And I guess I will end this one with there is hope, and there's stuff that we can do. And Cody and I are going to jump and do another recording that we'll post in a couple of days. And that is going to be deep diving in exactly what Cody does when she's working with someone diagnosed with SLE, how she helps people when they've got the potential of kidney failure. She's seeing those anti-DNA markers in the blood, and what she would do in there to go in there and be really proactive and protect them. And we'll get right in and we'll dissect the diet, and we'll go through all of that. But I want to thank you for your time today, Cody, and thank you for walking us through lupus. And I guess the big thing I hope that everyone realizes that there is hope, even with these potentially terrible life-threatening diseases, that there are things that we can do. And the earlier that you get in there and get some help with that, generally, I know for me, and I'm sure Cody would agree, the better we see the long-term outcomes. But yeah, so don't forget to hit subscribe below, and I will put all of Cody's details in there. Cody does do telehealth consults. As you heard, she's in Australia, even though she's got that beautiful British accent, but she's got patients all around. So if you have been diagnosed with lupus and you want to work with someone that is passionate about it, has so much first-hand experience, and is working with people and having these amazing results of getting people in remission, I'll put her details below. You can click on that and book a consult with her online, and she would be very happy to support you. Thanks again, Cody. We will catch up and the next one, and I wish all of our kidney community a wonderful day, and we'll talk to you next time. Bye.
Thank you. Bye.